Lung cancer is by far the leading cause of cancer deaths among men and women, claiming more lives than breast, colon, and prostate cancers combined, killing twice as many women as breast cancer. But there is a stigma associated with lung cancer that only those who smoke will get the disease. So in some way, they're responsible for their illness. The truth is that 65% of lung cancer patients either never smoked or quit smoking years ago. Today, Dr. Christine Lovely and Linnea Olson, a lung cancer patient, will discuss treatment breakthroughs in the battle against lung cancer and how the Lung Cancer Foundation of America is working to fund life-saving research. Dr. Lovely, we know lung cancer is the most deadly form of cancer. Is there new hope for people who are diagnosed?
Absolutely, and thank you so much for that really wonderful introduction. Lung cancer is a major public health problem in the United States, and just to give some numbers, there are more than 235,000 new cases of lung cancer in the United States every year, which translates to somebody being diagnosed once every about 2 minutes in our country. That said, there's a lot of really exciting research and new treatments for patients with lung cancer, ranging the spectrum from finding the cancer early in patients who are at risk but don't yet have cancer, so screening studies, screening tests for lung cancer, to new treatments for patients who have lung cancer, like targeted therapies and immunotherapy, to new ways that we can monitor and diagnose the cancer through procedures called liquid biopsies, which is actually looking for the lung cancer in a patient's blood.
Now, doctor, who should get screened right now?
Yeah, so that's a great question. I think this is an area of tremendous research. I'm going to tell you what the current guidelines suggest. In 2018, the screening study suggests that we should screen patients who are 55 or older, who are current or former smokers having quit in the last 15 years. Now, lung cancer screening involves a CT scan, which can be done in most doctors' offices, and I would encourage everybody who's watching this broadcast to speak to their doctors about it. However, what I also want to emphasize is though lung cancer screening has been really a remarkable advancement in early detection of lung cancer, that it's not going to catch every lung cancer that's out there. And I think Linnea is a really fantastic example of a patient who has lung cancer who wouldn't have been eligible for screening.
Can you explain more about your research and how liquid biopsies are helping to save lives?
Sure. So liquid biopsies, let me take a step back and say that the traditional way that we actually look at lung cancer, that we biopsy a lung cancer, is by putting a needle through a patient's chest to actually grab a piece of the tumor. That's an invasive procedure that can actually cause some danger to the patient. Now there's new ways that are emerging to actually find lung cancer in the blood, so the tumor can actually shed off pieces of DNA into the blood that we can monitor and find DNA in the blood.
And Linnea, you say you decided to be an outlier. At 13 and a half years and 3 clinical trials later, you're here to tell lung cancer patients that you can never give up hope.
Oh, that's right. Always think possible, not probable. And I had an oncologist early on who described a bell curve to me, and he said, there are people at this end who don't do well. Most of the people are here in the middle, and there's people way out on that end who are outliers, and that's where I set my sight.
How has lung cancer research helped you personally?
Well, I wouldn't be alive without lung cancer research, because when I was diagnosed in 2005, treatment options were still very, very limited. In 2008, I was told I had 3 to 5 months left to live. That was prior to learning that I had an ALK mutation. Once I learned I had the mutation, I had the opportunity to enroll in a first-in-human clinical trial targeting that mutation, and that's why I'm still alive.
And where can our viewers go to get more information, and what can they do to help?
for a very reliable website, I would encourage all of your viewers to look at lcfamerica.org. This is a website that is powered by the Lung Cancer Foundation of America. It is an advocacy group for lung cancer patients and their family members. And really, take-home messages are, there's a lot of excitement in lung cancer. We still have a long way to go. Please support lung cancer research because this is a major, major public health problem in our country.
Ladies, thank you for making some time for us today.
Thank you for having us.